Hi, I'm Dr. Monte Ketchum, a non-surgical sports medicine physician with Andrews Sports Medicine and Orthopaedic Center. I treat patients at Andrews, Cullman, and Birmingham locations. As a non-surgical sports medicine physician, we treat patients of all different ages, from young to elderly, whether it's an acute problem, a chronic problem, or anything in between. My goal as a non-surgical sports medicine physician is to try to treat the patient conservatively, try to exhaust all conservative options that we have. However, if they don't improve, or if they come in with an acute injury that does need surgery, it's a very seamless process to get them in with our surgeon. I grew up in Brooksville, Florida. It's a small town about an hour north of Tampa. My dream was to play Division I baseball, so I played 2 years of junior college baseball, and then I transferred to Western Kentucky University and played 2 years for them. So following my time at Western Kentucky, I started medical school at Lincoln Memorial, DeBusk College of Osteopathic Medicine. Growing up in sports, growing up in athletics, obviously I heard the name Dr. James Andrews. So my ultimate goal was to train here at Andrews Sports Medicine in Birmingham, Alabama. I did my one-year fellowship training at the American Sports Medicine Institute. During my fellowship, I had the opportunity to work closely with Dr. Dugas, Dr. Ortega. With Dr. Dugas, I spent a great deal of time working at Troy University and covering all of their football games. I met my wife Ashley in medical school. First day orientation. She's a pediatrician with internal medicine and pediatrics of Cullman. We also have a son named Tucker and a chocolate lab named Maddie. When we were offered the opportunity to move to Cullman, we were excited, and our goal eventually, whenever we finished our training, was to end up in a smaller city, somewhere good to raise our kids, and somewhere we can, set our roots in and become a strong part of the community. So one of the main things that drew me to orthopedics in medical school was that patients come in and they have a problem and they are looking for a way to fix it. So I enjoy being part of the patient care and helping that patient get their problem fixed and being able to move on with their life, whether that is athletics or just being able to run a couple laps. I want to be able to get them back to where they need to be. So from being an athlete myself, I've learned that one of the most important things to me when I was seeing a physician was to make sure they listened to my problem, listened to what I had to say. So going into med school, that was something that I always wanted to make sure was the top of my list, and one of my top priorities was to make sure that my patient felt like I sat down, talked to them, and listened to everything that they had to say. The other thing that I try to make sure I do a good job of is to make sure they understand exactly what's going on before they leave. No one in my family has a medical background, and so I've seen firsthand how confusing it can be after leaving a doctor's office when they tell you a diagnosis, but it's in medical terms that may not be everyday words for most people, because our goal is to ultimately obtain victory over injury.